Welcome everyone to the Lymphie Strong YouTube channel. Today I have a very dear friend and special guest who is joining me from Juzo USA. Caroline Pinney is the Education and Training Manager. She and I met about 2 years ago at the Juzo headquarters in Ohio, and I'm just very, very happy to have her on as a guest today. How are you doing, Caroline?
I'm awesome. I'm so happy to be with you today.
We just saw each other at the National Lymphedema Network conference over in Boston. You did a fabulous job educating the physical and occupational therapists, certified lymphedema therapists from around the country, and some from as far as the Philippines and Costa Rica. What was that like?
Gosh, it was so nice to be in person again. And I always love to see everybody in the lymphedema community. And I really enjoyed it. I love meeting new people, hearing wonderful stories about, successes and learning as much as I can. So we had a lot of great thought leaders there and leadership like yourself. So it was just amazing.
Yeah, it was so amazing. I couldn't agree with you more about just meeting everyone in person again and everyone getting out and looking to refresh their skills. So with that being said, I thought it would be appropriate to have a patient education webinar session on compression and what that's like from Juzo. I've personally been wearing Juzo since 2014, which is the first opportunity that I had to have complete decongestive therapy, went through the wrapping, through the reduction, and then the first garments that I was introduced to were Juzo. And they helped me maintain my reduction, and I even achieved further reduction, into the following year. So I'm a huge advocate for compression and specifically for Juzo because it changed my life. So I thought that I would start out with a very common question that members of the Lymphie Strong community have. What's the difference between circular knit and flat knit or off the shelf ab?
Yeah. Okay, I get that a lot too. And I can totally understand why that would be confusing for people. It really comes down to a difference in the manufacturing process. So a circular knitted machine knits around and around in a circular motion, and it produces a garment without a seam. So this is a circular knitted arm sleeve. Circular knitted products are typically available in standard sizes, which is a great thing if somebody is able to fit in an off the shelf size. So what that means is we take your measurements, we can plug it into a size chart, grab a box and hand it to you. Kind of like going to Target to get a dress and it should fit you pretty good. You can have some of the circular knitted fabrics made as customized solutions as well. Mm-hmm. So a circular knitted product is really meant for a limb that still has an anatomical profile or a limb that looks like a limb. Mm-hmm. Whereas a flat knitted product, we knit the product sort of in half. Like imagine this is a glove. The pattern would come off of our machine like this. Then we will fold the product in half, and then our seamstresses are going to sew piping on. So flat knitted products always have a seam. So this is a flat knitted arm sleeve. It still has two-way stretch, but you can probably tell just by looking at it that it's thicker. It has more density in the knit. And when you look at the seam should be sewn down nice and flat and have two-way stretch. That's going to be really important for you to be comfortable and also safe. So these are just side-by-side comparison, circular knitted and flat knitted. And flat knitted are almost always customized solutions. And that's standard in the industry. That's not just a Juzo thing. So these customized solutions are made specifically for each individual patient. So it should fit you just like somebody, like if instead of going to Target to buy that dress, you go to a seamstress and they make it all, just for you.
Yeah, like I mentioned earlier, I had the opportunity to visit the manufacturing facility, and to me, the machine that made the circular knit looked like an ice cream cone.
That's a good
that,
analogy.
that basically spun around, and I'm partial to legs because I have lower extremity lymphedema, and
Yeah.
I really thought it looked like an ice cream cone. And whereas the custom actually has hands-on seamstresses that are highly skilled actually doing the sewing to put the garment together.
Yeah, people are always asking me how much things cost, for customized solutions. And it really isn't about how much fabric we're using. A lot of times it's because we need to charge more because of all the detail. And like you said, we have seamstresses that have been there for 30 years, 25 years. So they're very good at what they do. And that's what we really hang our hat on, is the quality. Like that's Juzo. We want our products to have that reputation of quality. So that's why we, have those steps to ensure that everything is precise.
So I think the next question that is really, really popular is
Yeah.
what type of options, sometimes in the community groups that I run on Facebook, well, we will have members who mention that they experience things like chafing, pressure points. Sometimes there's either friction at the elbow or maybe behind the knee, and or maybe they're like me and a little bit lopsided. I've had lymphedema in my right leg since 1994, and I've had it in my left leg since 2007. So I always feel like I need just a little bit more power on the right leg versus the left. And the good thing about that is because there are custom options, you can accommodate that, right?
Yes, that's a really great question. And I think a lot of people aren't aware of all the options that are out there. So like you said, you need a little more compression on one side than the other. And I'll show you a pediatric pantyhose right here. I'll give
Oh
you
my
1 second to say, ah.
Oh.
No, but this is just an easy way for me to show you. You could have a compression level, let's say 1 here, and a compression level 2 here. So you can actually, tell us exactly how much compression you want. See how there are different seams. So this side could be 1 compression level, this side, and then this abdominal area could even be a different compression level. So that's the nice thing about custom. You mentioned when somebody gets sort of maybe a little bit of irritation at the folds, that's very common. And we have something that it's something that's sewn on the inside, and it can help alleviate those irritations. So we can sew little additional pieces of fabric, either in a really shiny, silky charmeuse fabric or silver. And you don't have to really give us any additional measurements. We just sew it right there. So common places would be right here at your elbow where you're bending, behind your knee. Also, you can get them between your fingers or at your thumb web. So, or you can put it anywhere. Maybe you've had a procedure done that's caused, an area that's very sensitive. So those are called comfort patches. Do you mind? I'll show you a couple other things really quickly.
Sure.
So
Absolutely.
another thing I always like to mention. So let's see here. These pantyhose, where are they? These pantyhose have an arc. See the small arc at the top?
Oh, I love that.
This is a little bit more pronounced, but that's why there's an arc. So in other words, the waistband isn't fitting straight across. The reason that you would do that is, you think about it, these are medical grade, hefty duty pantyhose here. If you sit down, then guess what? If you don't have that arc, then you're probably going to be showing people little plumber's crack.
Right.
So
right.
by arcing it, that's a great idea. You can also arc an arm sleeve or a knee high. see if I have one of those. Okay, this is an example of taking the arm sleeve up a little bit. See, this one here doesn't do that. It goes straight across. This is what we're talking about. And this,
interesting.
yeah, and this is really useful if maybe you have a lot of soft tissue, and if you arc it, it brings that compression up just a little bit and it can support it. So it's a very popular option. And again, you don't have to give special measurements for that. Another way to help keep an arm sleeve up is if you use an arm sleeve with a shoulder strap. So this is really good if you have a really heavy limb, a lot of tissue. Listen, nobody really wants to wear the strap. It would go above the breast or between, but this does offer maximum lateral stability. So, you know, you've got tools out there. I can show you a couple more things. This
Absolutely.
is
Sure.
great. This is a glove. This is one of the only things that you can get in standard sizes at Juzo in a flat knitted fabric. So we get 2 gloves in standard sizes, but what makes this really interesting is that it has vents. Do you see those diamond vents?
Oh, wow. Yeah, the diamond pattern.
Yep, and that's on both sides of the glove. And the reason that we came out with this is because Walter Zorn, who is our president of production, who is Mrs. Zorn's son, he was sitting on a lady in an airplane and she was wearing Juzo, and he asked for feedback. And this was about 10 years ago. And she said, I love Juzo, but I wish you had a glove that was more breathable because I'm really active. So he took that back to the plant, and that's how we came up with the glove. So it's really great, really good if you're active too. And it doesn't compromise, you know, the efficacy of the garment. So it just makes air permeate and move around a little more. And the last thing I'll show you, well, second to last, let me see, where did I put those? Okay, so this is an example of taking the gluteal panel down just a little bit. So I know it's a little difficult to do this, but if you can see the difference in the stitching right there.
Oh, yeah. Yeah.
So what we're doing,
absolutely.
yep. What we're doing is we're taking the back panty paddle down just a little bit. And what that's going to do is support the booty, and it's going to prevent any kind, support the booty. It's going to prevent any soft tissue from rolling over. And when that happens, it can cause a lot of moisture to get trapped in there. So that's extending the back panty panel. And the last thing I'll show you, which I think could save people a lot of money, if you have swelling in your toes, the actual pantyhose, we don't put any kind of, this is not medical compression here. So if you actually had toe swelling, you would need to get a toe cap, or it's sort of like a glove for your toes. And you can get a customized solution, which is what we used to do in the past, but yay, we came out with this. This is a standard size toe cap. This will save people lots of money, because now instead of having to spend all of this money on a custom, if you can pull it off, you know, do this. And it has this these little special stitching. I mean, it's really comfortable and it works great. So I just wanted to show you some of the toys in the toy box today.
Oh, that's wonderful. I mean, I've actually had the Juzo Expert custom, and I've had that art on the waist.
Oh yeah.
I was unaware that it was available, you know, for the sleeve and the thigh.
And knee high too.
And then another good option is if you're unilateral, meaning you only have lymphedema in one leg, you can actually make one that's kind of like the entire leg on one side, and then like a biker short on the other side, to make it, you know, avoid using glue, or, you know, it's slipping down during the day too.
Yeah. And if you're unilateral, you can always get a hip attachment too, which is sort of like, it's sort of like chaps, but just one-sided.
Right. So the next question I have is, do you have to wear different compression if you have lymphedema versus lipedema?
Oh gosh. boy, is lipedema lighting up right now. Wouldn't you agree?
I agree. I mean, they're coming out in full force on Instagram. There are so many patient associations, and I mean, they're just making so much headway. June is Lipedema Awareness Month, and that's where we see, all of the advocates and information. But lipedema care is year round, so it never hurts to talk about it. Even
I
in
agree.
October.
Yeah. Well, I love this quote. A lot of folks, even in the medical community, aren't very aware of lipedema. And I love this. It is not a rare disease. In fact, it is actually impacting 11% of our population. So it's not a rare disease, but the diagnosis is rarely made. So that's the sad part. But I'm glad we're making some headway. And I love that question. So here's the tricky thing about lipedema. So lipedema is a fat disorder involving the loose connective tissue. So one of the really tricky things for lipedema patients is that they have a lot of trouble tolerating pressure. And so when you think about compression for a lipedema patient, it can get tricky. So lipedema typically involves the lower extremity from the hips down. It's a foot-sparing disease. So we always say at Juzo, listen, we have to remember everybody has their own individual story, and you can't just say, I don't care if this hurts, you have to be in this. We need to work with the patient to figure out what is going to be best for them. Something's better than nothing. So a couple things I've seen for lipedema patients, if they don't have lobes and folds, I like the Juzo soft leggings. So those are footless pantyhose, but they're only available in 15 to 20. But sometimes, if somebody can wear those, that's a good option because, it's comfortable, it's soft, it's giving them light support. One thing that I really, really, really love for lipedema patients is a compression wrap. Compression wraps allow you to adjust the straps to whatever you can tolerate. So I love this product for a lipedema patient because it gives them control. They can put the amount of pressure on, and if it becomes uncomfortable, they can adjust it. I have another product that I think we'll talk about later, but that's also a good lipedema product to pair, and that's soft compress. I'll talk about that a little bit more later, but this is like the perfect marriage for a lipedema patient, especially if they're just at home. They've got this nice, comfortable foam against their body. You can adjust the straps. So the answer is it's not all compression is the same because not all patients are going to be the same. And ideally, you'd like most of the time for a lipedema patient, especially when they're in the later stages, they probably need to be in a flat-knitted product. And so if they had to choose a flat-knitted product, I would recommend the Expert and using cotton covering as an option. So we call that the Juzo Expert Cotton. So now you've got this nice soft cotton against the skin, and it's just more easily tolerated.
Sure. I've actually tried the Velcro wraps, and I'm not sure a lot of people know that Juzo makes Velcro wraps. They're very comfortable. I've worn them personally when I have flown, when flying, and I need a little bit more compression, and it's adjustable, when you're flying. Not only lymphedema patients or lymphatic patients, but just about everybody generally swells when they fly, especially if it's for a long trip. So they're adjustable and really easy to don and take off.
This is an arm sleeve. I'll just show you. And it has a liner and the lower, we have a liner for the lower extremity now too. And it's just super easy to self-apply. A compression wrap should have very little to no stretch at all. That's what makes the thing work. And so you can use this as a reduction tool or a maintenance tool. This is obviously not my size, but you get the gist here. So you just put this thing on. But the really cool thing about these, since they don't have any stretch, they should have very little to no stretch. They have so many uses. So, you know, compression garments are contraindicated for nighttime use. So you're not supposed to use those at night because they can cut off your circulation and you don't know it while you're sleeping. But since these guys don't have any stretch, you can use this at night. And you can also use it as a reduction tool. Maybe you have intermittent swelling, or maybe you don't want to self-bandage. You can use this, and you can use it if you know, are not in the mood for the garments that day, or you're having trouble donning and doffing. So they're great. I love compression garments too. Or wraps, I meant wraps.
Yes, absolutely. The other question that I had was, how do you wash Juzo compression? This question comes up every now and then, and it always sets off a huge debate. So I want to hear it straight from the education and training manager. How do you wash Juzo compression?
Okay, so buckle up. It's pretty easy, but you're right. I get this question all the time, and I love to answer it. So first off, the first thing I recommend is get yourself a garment bag. We sell a garment bag at Juzo. You can use that, or you can go to the Dollar Tree, get one there, or use a pillowcase. But these things are expensive, and you want to protect your investment. So just make sure you do get a garment bag and get some donning gloves so you protect the garment. So when you take care of the garment, the detergent is a huge thing. You want to choose a detergent that doesn't have any additives. We have a detergent at Juzo, or if you want to go to the grocery and buy a detergent, that's okay, no problem, but just make sure it doesn't have additives. So what I mean by that, no fragrance, no bleach, and no softening agents. Those can ruin the garment and compromise the effectiveness of the garment. So you want to put the garment in the washing machine on the low temperature setting with that detergent that doesn't have any additives. Then you're going to, here's the part where people are surprised, put it in the dryer. Now, we want you to put it in the dryer without a fabric softener, because again, that will compromise it. But our product has memory threads, and the only way that they can properly go back to their original effectiveness is if they go into the dryer. The heat source is what allows the product to go back. It's kind of like if you have a pair of blue jeans and you wear it for, you know, a couple of days and it start like, oh, these are getting looser. This is good. I'm losing weight. And then you put it in the washing machine and dryer and you're like, oh, wait a minute. So it's kind of the same thing. But you do need to wash, you need to launder the product after every use. So wash and launder after every use. That's important because those dead skin cells and oils and sweat, it can put you at a higher likelihood of getting an infection.
Yeah,
so
we don't want that with lymphedema.
No. And like I said, just make sure that you get that product in the dryer.
Absolutely. I love it. And that's probably one of the best things I love about Juzo is you can throw it in the dryer. Just hanging everything everywhere. Just it's unsightly.
Yeah. Well,
I mean, you
and
do it if you have to, but
well, a lot of people don't realize this, but if you hang your compression garment over a towel bar, the weight of the moisture can stretch it out. So that's if you do air dry something, make sure you lie it flat, not over a towel bar, because the moisture can stretch it out.
Wow, I've learned 2 new things this session. I've learned that you can have the arc option on something other than the waist, and then also moisture from a towel bar can stretch out the garment.
Yeah.
I did not know that.
Good.
So let's see. This is another question that comes up very often. Where can I, you know, these garments are expensive. We use them. Sometimes people, maybe a garment doesn't work out and they've only worn it a few times. I often get the question, where can I donate my used Juzo compression? What are your thoughts on that?
I understand where people are coming from, and that's just being a kind person, but it's not a good idea. I can't imagine any health professional telling you that would be a good idea. So there's no organization that I'm aware of that actively takes donations. There's a lot behind that. These are medical grade solutions. So these are considered medical devices, believe it or not. And so you really need to remember that, you know, we can't self-diagnose and self-treat. We really should see a good certified fitter to be fit in a compression garment. And you should also remember that, you know, these all have different compression levels. There's a lot to that. So I would stay away from that. I know that that's coming from a really good place in someone's heart when they're asking about donations, but it's definitely not recommended. Don't share your compression. And, you know, lots of times I tell people you get a compression wardrobe over time. You know, maybe it's not fitting as well, but you might wear that compression garment when you're gardening or doing housework or something like that. You know, so yes, stay away from donating your garments.
Yeah, I have found that personally, just the, you know, compression is gradient, which means that it's strongest the furthest from the heart, right, distally. And sometimes that wears out differently over time, and it may not be uniform when the garment has been used for a few months, because the efficacy obviously wears down over time and with washes. So
yeah, go ahead.
Go ahead.
They have compression garments, and this is standard in the industry, have a 6 month shelf life. So that means if I just buy this one arm sleeve right here, those elastomers, those memory elastomers are going to wear down. And if I just wear this one compression garment every day for 6 months, I'm going to need to replace it. I always tell people, get one to wash and one to wear at least. That way, you know, you always have something, and then you get a year's worth because you're not wearing it every day. Does that make sense?
Yes, that makes total sense.
Yeah.
And also, I think sometimes as patients, we don't realize that we become complacent with a garment, and we think, oh, you know, this is, I'm doing well. And then we get a new garment and it's like, whoa, this one's tight.
Darn it. That is so true.
I forgot how, you know, 30, 40 or class 2 actually really feels like, you know, fresh out of the package.
That's really funny.
Yeah, I really got in my comfort zone with that. Let me put that old garment on.
Yeah.
Just a little Lymphie humor there. So my last question, and we do have 3 people in the attending today live, but my last question is, why does Juzo believe in the freedom to make the most of every day and freedom in motion?
Oh, that's great. Well, I don't know if I mentioned, but Juzo is a family-run business, and we've been knitting for over 109 years. And one of the things that we've always laid our hat on has been quality and making sure that we have just the best solution possible for a patient. And a lot of that comes down to the founder of our company. Julius Zorn is the founder of our company, and it's the first 2 initials of his first name and then the first 2 of his last name. That's how we came up with Juzo and Juzo. So Julius had a scoliosis of the spine, and he had to wear a really uncomfortable metal back brace. So think back 109 years ago. So when they decided to get into the knitting business, he said, you know, the number one thing to take care of is to make sure that these products are comfortable and that, you know, we can offer the most comfortable possible solution, because he knew what it meant to rely on a medical device to help him, and he had to wear it every day. So that's really where we come up with freedom of range of motion, you know, freedom
to move every day. Yeah.
Freedom to move every day. So he decided back when we got into knitting to make sure that we really made sure that our products helped folks and gave them that freedom. So that's just a founding philosophy of our company. We just want to make sure that we have the very best product and that it's comfortable.
And, I have to say that that's not just a slogan. Juzo has been a proud sponsor of the Lymphie Strong Move That Limb Challenges since 2017. So we've just come upon our 4-year anniversary in collaboration with Juzo USA. I love the Juzo family. I feel very much a part of the Juzo family. And I really have to say that I love just the feeling and the warmth and all of the good that you promote through the Juzo Champion program. It really means a lot, I know, to the community, and I just want to pass on my personal thanks for that.
Aw, and we love you. It was so great seeing so many, our Juzo champions at the NLN, including you, and it's just awesome. We just
So
all
awesome.
get to see each other, and we're all kind of just trying to spread the word and help each other out. I love it.
Yeah, right now I've been wearing the Juzo to work out. The Juzo Soft and the tie-dye is my favorite go-to garment. I wear the 30-40. I know I'm supposed to wear a flat neck while I exercise, but I just feel like it's so breathable and allows me to move, and I don't feel as constricted. So there goes that freedom in motion. And I have a bit of a moniker at the gym. I've been called the tights lady before.
Ooh.
Because
I love it.
I wear the shorts, and I have the purple and white tie-dye, and then the pink and the black, and so I mix and match different colors depending on what's seasonally available. And that's another great thing that I like about the Juzo line is you refresh the colors
annually,
at least once a year.
Once a year, yeah. I love that you are representing the Lymphie community, going to the gym with your tights on. Love it. I love it. It's great. Good for you.
I know a lot of people don't know. I did have some swelling in my back at one point that seems to be like really under control now. But at one point I had a Juzo custom vest made. It's in one of my blog posts from years ago.
Okay.
Juzo was one of the first custom garments I wore for it was literally a vest, a custom vest.
Yeah.
And it fit me perfectly like a glove. And
good.
I don't think a lot of people know about that either. And Juzo is not like a one-trick pony.
No.
Just, you can create all kinds of things. And so I encourage every member of the community, if there is something bothering you, or if you feel like you have a better way or something that you want added to your garment, by all means, speak up. Talk to your certified lymphedema therapist, or talk to your certified fitter and request it.
Absolutely. I've been there for 12 years now. I cannot think of one time where we said, I'm sorry, no, we can't make this. We really pride ourselves on having all that experience and helping people out the best we can. Just anything that we can do to help somebody have a comfortable and effective garment. That's our goal.
Absolutely. 109 years of experience.
Yep.
You have to apply it somewhere.
I know. It's hard to believe.
Well, we've come up here on the half hour, and I don't think we have any questions so far. Okay. I'm sure others will arise, when we upload to YouTube and post it in the group. And of course, I know you're just an email away. I want to thank you so much from the bottom of my heart for being my guest today. And thank you for all you do for the lymphedema community.
Thank you so much for having me today. And it's been my pleasure. Thank you so much.